The broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to our April Dementia Dialogue entitled Through a Diverse Lens. My name is Heather Mulder and I'm the Outreach Program Manager at Banner Alzheimer's Institute. I will also be the moderator of today's discussion. In 2018, we have been in a pursuit of answers where every dialogue is trying to answer a different question pertinent to caregivers of people with dementia. So this month, we're going to be examining how is dementia and caregiving perceived in different cultures. I think this is a hugely important topic because we have so much that we can learn when we learn of the perceptions of other people. And so I'm looking forward to a really engaging and enlightening discussion this morning. Before we get started, I want to introduce our panelists today. Nicole Lomé is the Community Outreach Representative for the Native American Program at Banner Alzheimer's Institute in Phoenix, Arizona, where she is responsible for setting a new standard of care for dementia patients and their families by raising awareness about dementia, evaluating culturally sensitive cognitive assessments, bringing brain health programs, and identifying the types of education and outreach activities to meet the unique needs of the Southwest tribes. Nicole completed her Bachelor of Interdisciplinary Studies with an emphasis on sociology and Native American justice studies from Arizona State University. Nicole has extensive experience working with the Native American community and community-based programs through the work she has done as a Native American coordinator for an urban school district, facilitating Native American support groups for a federal program, and as a case manager for the state of Arizona. Welcome, Nicole. Thank you for joining us today.
Thank you.
Our other panelist today is Angela Allen. Angela has a Doctor of Philosophy from Arizona State University College of Nursing and Healthcare Innovation. She is also a certified rehabilitation registered nurse with a specialization in research. Dr. Allen serves as the Clinical Research Program Director of Nursing Research at Banner Alzheimer's Institute and Banner Sun Health Research Institute. She is also a clinical instructor at Arizona State University. She's been employed with Banner Health and Arizona State University for over 12 years and currently serves in numerous capacities, including Arizona State University John A. Hartford Fellow and Brain Health Co-Investigator for a research intervention study titled Dementia Care Model. She has recently begun a program with Banner Health called Dementia Awareness in Hospital Settings. Additionally, Dr. Allen is the current chair of Arizona Community Foundation Black Philanthropist Initiative, immediate past president of Black Nurses Association of Greater Phoenix Area, Delta Sigma Theta Sorority, Phoenix Metropolitan Alumni Chapter, having served as the chair of the Physical and Mental Health Committee. She currently serves on several boards such as National Black Nurses Association in Washington, D.C., National Association of Rehabilitation Nurses in Illinois, Tanner Community Development Corporation in Phoenix, Arizona, Senior Leadership Council for Alzheimer's Association in Phoenix, Arizona, Arizona Geriatric Society, consultant for the National Brain Health Center for African Americans in Richmond, Virginia, as well as a curriculum developer, peer reviewer, and special interest group chairperson for the National Association of Rehabilitation Nursing. Dr. Allen is a member of over 20 other organizations. Welcome, Dr. Allen. Thank you for joining us.
Thank you.
And again, I'm looking forward to such an interesting discussion. And I know we have just looked at two communities today, and I think this could be a much larger discussion in the future. But in the interest of time, I'm so excited to have Dr. Allen and Nicole with us this afternoon. So let's just jump right in and get started on our discussion with a very broad question. Can you tell me what generally makes your culture unique?
Well, Heather, what makes the African American culture unique is our unity and unconscious competence of our ethnic culture, meaning that we don't realize who we really are until we identify who we are. Though we are drawn from a diverse range of countries and cultures, and when I say culture, when we think of African Americans, we think of different skin colors, we think of our religious backgrounds, which is a variety, our socioeconomic status, our geographical location, and more importantly, our language. And many people are not aware that we have several languages. Our unique trait is that we share a common history of acculturation, which gives us relevance to the initial bond of our heritage. That bond remains evident even today as we view the African American connectedness in the community, especially as it relates to our older population. So I believe that's what truly makes us unique.
Thank you. Nicole?
So what makes the Native American culture unique is that here in Arizona, there are actually 22 federally recognized tribes that all have different languages, traditional and cultural beliefs. Their origin stories are actually all different. The education level is actually all varied. Some folks have minimal education. Some have gone through and finished their high school education. Some have actually gone through the boarding school experience, which part of that education was actually trying to assimilate them into the main culture. And also some have actually have their college education, so just the education part of it is varied. One of the things, though, that makes the Native American community unique is that it's actually one of the most underserved and underrepresented community in the United States. And so there's so much work that needs to be done in these communities in terms of dementia and educational work that needs to go around this, that actually needs to be wrapped around this community.
Thank you. Thank you both. I think we can now kind of jump into more specific questions that might be relatable to caregivers. And the first one that I have for you is, how is cognitive impairment perceived in your culture?
So cognitive impairment, there's actually various viewpoints in the Native American community. There's such a lack of education around dementia that sometimes the viewpoint of people it's varied. So in some of the different cultures, there's actually a belief that their dementia journey is actually part of that journey that they take to go on to another world. So when they pass away from this world, they go into the next. And another perception is just simply that, the person is actually, ill with this disease. Again, there's so many different perceptions of impairment that I'm not familiar with all of them. I'm just kind of giving a snapshot of what's happening here in the state of Arizona. But with what's happening across the nation, you have over 550 different types of all various different tribal beliefs and their traditional viewpoints on what dementia is. That I'm not even sure what those all are, but I just wanted to mention these couple of points.
And I think yesterday when we were talking, you had mentioned that some individuals don't even want to talk about dementia because they're concerned about then developing it themselves.
Yes, so there's also that it's a taboo that lots of the belief that talking about something negatively, that it can actually rebound and come on to them. So this is something that can be difficult to talk about. But then there's also, and I'm sure it's common from the community in general, is that fear of actually talking about dementia and having to kind of face that reality, and that everyone is at risk of developing, a dementia at one point in time. So it's a very scary topic to talk about.
Well, I appreciate Nicole sharing that. I wasn't aware of that as it relates to the African American community. And before I say that, we know that different ethnic groups have different knowledge and beliefs, behaviors, values, and practices when it comes to the influence of the roles that individuals play. One of the things that relates to the African American community, we're more likely to perceive cognitive impairment as a normal part of aging. That's something that happens when a person gets old, is expected for that individual to act the way they do. It has happened to my great-grandmother, or it has happened to my grandmother, or it has happened to my aunt. And in those cases, I've identified that as, there is that's that time in when the person is just, obviously getting old, not only physically, but mentally. But as a researcher and a person who is involved in this in Alzheimer's, I know that's different. In the community, in the African American community, not only is it perceived as a person who's getting older, but one of the greatest domains that the African American community has talked about is religion. It's God's will that this person is behaving the way they are, or their mind has obviously taken a toll for the worst. The other issues that African Americans perceive is stress. They relate that back to what I shared earlier, our ancestors, the history, the challenges that the African Americans have endured. So stress, and they tend not to say the word depression, but that's evidence that may be a rationale behind the way a person is behaving or they perceive Alzheimer's disease. They never say the word Alzheimer's. They perceive it as just being that situation as relates to stress. Possibly head injuries, some type of other comorbidity that may have infected or impacted that individual's behavior, whether it's head injuries due to some type of concern that may have occurred, motor vehicle, or something in that nature, exposure to toxins. It could be related to the environment. Perhaps, and in some cases, I know there are Southern African Americans who may have stated, based on where they live, or even in the Midwest, particularly where I'm from in Michigan, there have been people who talked about the motor vehicle industry and how that may have had a play on the way a person has perceived cognitive impairment. Again, never bringing up the word Alzheimer's or disease or dementia, just primarily focusing on those areas. Mental illness, they may have related that to perhaps this person in the past has had some issues with schizophrenia or having some bipolar issues. So that's why they're behaving that way. Again, never saying the word Alzheimer's disease or dementia. And then more importantly, and I know this has occurred a lot in the 60s and 70s, alcohol abuse, excessive alcohol. And again, back in the 60s and 70s, you have a typical person in the African American community based on, certain type of stress, again, overusing alcohol, and now they've gotten older, and that is the reason why, again, their cognitive ability has impacted them. And then I would also bring up the genetic factors. There may have been some issues as it relates to the genes, and oftentimes someone will say, my grandmother or my great-grandmother was senile, and so that's why my mother or my grandmother, if you will, behaves in that way. So again, the person or our culture perceiving, cognitive impairment is never identified by the term dementia or related Alzheimer's disease or related dementia. Is perceived by everything else that may have impacted them. Mm.
So it's pretty similar with the Native American community, where they do see it as a normal part of aging. And I think that's the part that we really need to get them educated and understanding that there are differences between a memory impairment and then something where it's, something more serious. So, and she's correct in that it's similar. Alzheimer's disease is one of the things that they don't really want to talk about or even say. It's all these other things, mental health issues, alcoholism, those types of things that kind of plague these communities. So, so it's very scary for them. It really is.
Very interesting. And so we go from this broad, how is cognitive impairment perceived, now a little more specific, how is the person who has dementia viewed?
So the person with dementia, within a community, usually when I go into a community and I'm talking to them about, just education work, finding out what's happening within the community, trying to assess what their needs are, there's always a story about a specific person that impacts the community. So for example, I went into a community, they had an individual who had a diagnosis of Alzheimer's disease, but this person was actually being allowed to continue to drive in the community. So they would find this person's truck at a stoplight where she would be braked, or she'd be off the road, or, she would be standing beside her truck, or she would be, just walking around it. So everyone was familiar with this woman who was impacting, the community by not being safe. Or maybe the police would go and take her keys, they would take her driver's license away, but she would somehow manage to get into her truck. But the community kind of viewed her, I think, at that point in time as someone who actually was having problems with her memory. They didn't look down on her or anything like that. There wasn't anything like that, but they were more careful, I think, when it came to identifying, okay, oh my goodness, your pickup is right there, so we're going to have to drive this other way. Or maybe they would call the relative and let them know, hey, you know, your person is actually out here on the road, you might want to pick them up. So it's not something that that they would, you know, see this person as being a difficult person or someone who, you know, they would try to stay away from or anything like that. They knew that this person was, you know, ill. So that's how they would look at it at that situation, and then they would try to see, okay, so we need to continue looking out. And as a community, that was something that I always seen within the community, was that they would keep an eye out for this particular person. So in case she wandered too far or she was in her truck, they would make sure they keep an eye on her wherever they were going, even though she wasn't a relative in a sense, but they would keep an eye on her.
Isn't that nice? That broader sense of community can support her.
Right.
So, is the person in the African American community, I would say, is viewed with dementia, is viewed with a stigma, interesting enough, within the family. In other words, we call it they're discriminated by their immediate family. And the immediate family, I'll give you an example. In some cases, I appreciate that example Nicole shared. Similar situation here. You have an African American grandmother who has some form of dementia. Possibly we would identify it as so. But the only person or people who are aware of it is those who live with that person, whether it's their children, their spouse, and it goes nowhere. It's known that grandmother has this disease, but we will not share it. So they're viewed as a person who's being protected by that immediate family. But interesting enough, as the disease progressed in the African American community, as the disease progressed, the people who are involved increase. The extended family is now involved. So let's say an individual is now going into a moderate stage. Now we're going to involve aunts, uncles, cousins, because they need to know that grandmother has something going on. And again, never the disease, it's more so the fact that there's something wrong, she's getting no. Now keep in mind that extended family is not just the aunts, uncles, and cousins. The extended family becomes the dominant person in the spiritual environment, and that may be the minister or the pastor or the deacons. They're informed that, yes, you know, grandmother hasn't gone to church anymore, or when she's there, she may act a different way because there's something going on. Interesting enough, that's where it ends, in the moderate stage. The person is then viewed as being, again, protected, and the family members and or that spiritual person would ask, would you like for anyone else to know? And if they say no, and oftentimes they do, then the person disappears from the spiritual environment, considered being ill, or just choosing not to go to church. They do not, our community in the African American, they tend to not extend it greater than that person. So the other members in the church may not even be aware of what's going on. So that person is now being viewed, again, they've gone from discriminated from their family to now being protected, guarded, and also losing dependency. And so that person is still loved on and cared for, but they're loved on and cared for in a different way. And I think in a way that's a good thing in the African American community, because here you now have some more connectiveness, as I shared earlier, that unique commonality that grandmother has brought the family together, but yet it's connectedness and unique bonding to something that is unknown. Not bringing up the word dementia or Alzheimer's disease, but just knowing that we all have to get together. And the word we could be that community that I shared, to care for that loved one who has some type of issue that has no physical impact, but yet a mental impact.
Very interesting. Thank you. We've looked a lot at now the person with dementia and cognitive impairment. I think the next logical question becomes, who are the caregivers typically in your culture, and how is caregiving perceived generally?
Heather, I think that's an excellent question. I like to bring this up in the African American community. Who are our caregivers? That's a good question. I would have to say, typically, not in all cases, typically you'll find the caregiver being a female, and that female is usually the individual that may not be so close to the loved one, but is, we call it next in line to do what they have to do. Is again, that's that immediate family member. The female, again, could be the daughter. That female may be the granddaughter. In some cases, it's the sister, the sister of the person with some form of dementia. Typically, that caregiver is the individual of age, maybe 40s, mid-40s or so, where they're established in their workplace and have an opportunity to perhaps remove themselves or decrease their hours because there's a need at home. That caregiver, and again, these are all informal caregivers. That caregiver is a person who may be a sandwich caregiver. They may be a mother of someone, yet the daughter of the person with dementia. They may be the grandmother of someone, yet the daughter of the person with dementia. So they're caring for more than just that individual. This person, again, may not be married, and that's an expectation in the African American community, to the point where you don't have that requirement of a wife. So here it is, we are going to ask you to, now step in line and care for grandmother or mother and utilize all resources. And the support is limited because they depend solely on that individual who's considered the caregiver. The caregiver is highly perceived. Once that person has taken on that role as a caregiver, then they are perceived as someone who's looked upon as, wow, we will support you indirectly, but directly we can't. We respect you in your role. And once that role has been removed, and as I pointed out earlier, if the person is being placed in a facility or whatever, then the individual who has had that role, that respect has decreased because it is expected for that individual in the African American community to care for that loved one as long as they are capable of doing so. And so, typically the caregiver is usually in that role. Oftentimes you may see another family member in the male area, maybe the son, but it's rare because they're still getting support from their wife if they're married or their other significant other to help care for that mother or father in that case.
Mm-hmm. So within the Native American community, caregivers can actually be the adult children. It could be aunts, uncles. It could be someone that may be a first, second, third, fourth cousin. It can be a clan relative. It could be anyone, any of the relatives, and it's usually relatives that would like to be the person to take care of that individual. And most Native American families, they don't describe the care that they provide as caregiving. Actually, most caregivers will see this as part of their duty to either take care of my parents or my mom needs help because she's getting older, that kind of mentality. Culturally, young ones are actually taught to respect their elders because of the wisdom and knowledge that they're able to pass on. So when an older one needs more help, they're generally taken care of by the family. And there's a situation where my aunt recently has been diagnosed with Alzheimer's disease. And my mother came from a family of about 13 children. And so I've already had an aunt and uncle that have passed away from Alzheimer's disease. So as a family unit, everybody comes together, they meet together, they have a meeting, they figure out what's going to happen with this person, and they start making plans and making arrangements for this person to be cared for. And then they continue to meet periodically to give updates and so forth. So if there's money or there's other needs that need to happen, that's when they're able to make their contribution to the caregiver. So, and then usually what happens is that if the caregiver is someone that decides that they want to be in that role and they happen to live in the city, what often happens is that they will actually leave their job, they will leave their home in the city, and they will actually move back to that person's home that may be in the rural area, because we know that if that our elders prefer to be cared for at home, but they also may lose benefits through the tribe, or they may lose even their healthcare benefits from moving away. And they also have that disconnection with their traditional and cultural practices. So that's something that does make a huge impact on that person. So they take a lot of those things into perspective, and the caregiver is actually, it's a very positive perception for them. So they're actually taking on this role, and everybody appreciates the role that is actually they're actually able to provide.
Mm-hmm. Interesting. And so the commonality between these two very different cultures is that the caregiver is perceived with a lot of respect in both instances. So we are actually running close to the end of our time together this afternoon, and so I just have one final question for both of you. What is the most important thing that you want us and our listeners to take away from today's session?
So one of the things I think that that I've taken away from this is that everyone has the same struggles. You know, education, support, and services are needed for everybody. And this continues to be the case. You know, we created a video about Native American caregivers in Arizona and a toolbox to help train professionals that work in these communities. The video was actually provided to show how caregivers are doing within different parts of Indian country here in Arizona, because what people were interested in was finding out how are other people doing in these other communities, taking care of these, taking care of their person. And so they started to see that there were similarities. So we had a very positive response when we had showed this at our state conference last year. And it just kind of shows the resiliency of caregivers, but there's still a lot of work that needs to be done, I think. And that's mostly what I've taken away from this, is that the education is so important.
Mm-hmm. Thank you.
I agree with you, Nicole. I would have to say what I've taken away from today as a formal and informal caregiver myself, just to obviously not be afraid of the diagnosis of Alzheimer's disease and related dementia, and not be afraid of being aware of what the disease is, having the knowledge, being able to manage the person in the home. And the fact that every culture, though we are different, we're still the same. As Heather pointed out, we all have that need of being able to get the information, whether it's from Banner Alzheimer's or any other facility, taking that information home literally and sharing with the family member, the community, and even society on how we as a community can best take care of our loved ones.
Thank you both for your perspectives. I think really the best takeaway that both of you brought forward is that this is not unique. We all know Alzheimer's disease does not discriminate by race, gender, socioeconomic status, education level. And while different cultures may approach this disease differently or view this disease and caregiving differently, we have that commonality among all of us, that each of us is touched and impacted by this disease. So thank you so much, Dr. Allen and Nicole, for your perspectives this morning. I hope that our listeners found these to be, at the very least, interesting, and as even better than that would be something that you can take home and maybe adopt in your own mindset in your role as a caregiver.
Thank you.
I would like to invite all of our listeners to join us next month on May 16th. We're going to now look at activities, often a big challenge for caregivers to figure out, how do you fill your person's time with meaning and purpose? And so in May, we're going to be doing a session entitled Let's Go. And the question that we're answering is, how do I get my person involved in activities when they have trouble initiating them? We have some exciting panelists that we'll bring in for that session as well. I want to thank you for attending the Dementia Dialogue this afternoon. Please use your voice and let us know what you thought of today's session. As soon as we close, you'll be emailed a session evaluation. Please take a couple moments to fill that out. And again, let us know what you thought of today's session and if there's anything further you would like to learn from us. Today's session has been recorded and will be housed on our website within a few days. I want to thank you for attending today's Dementia Dialogue, where we bring the dementia education to you.